Toms River, a town located just across the seaside bridge of the iconic Jersey Shore, is a large and densely populated town in the midst of Ocean County. The town is home to 100,467 residents per the U.S. Census Bureau and growing at a rate of 0.59% annually. The attraction to this town is due to its various housing types, with inland suburbs to mansions on the beach. The majority of homes are considered middle class with the average household income of $126,000. Despite this, there is still a considerably high poverty rate of 6.23% and a growing homeless population. Notably, Ocean County is an expensive place to live as it is a 12% higher cost of living as compared to the national average. The unemployment rate in 2025 was 4.3%, which is comparable to the national average. Despite being safe and having a generally satisfied community, there is an epidemic in Ocean County: substance abuse. In 2025, 15.5% of New Jersey residents self-reported a substance abuse disorder. Based on that statistic, it is reasonable to assume that upwards of 12,000 to 18,000 individuals are suffering from substance abuse disorder. The data further solidifies this as treatment admissions to any rehab, detox, or hospital related to substance abuse demonstrates a staggering number of substance abuse cases in 2023. 32,533 people were admitted for alcohol treatment, 26,285 for heroin, and 15,425 for other IV drugs. Additionally, there are a reported average of 5 overdoses daily. All of these factors combined signal a need for change immediately. The community agency I am working alongside is Community Medical Center's Emergency Department. This agency was an appropriate choice because it is often referred to as the first resources that patients utilize when problems arise related to substance abuse. This ranges from active intoxication, enduring withdrawal, or seeking recovery coordination. While resources exist outpatient to help navigate all of these problems, the ED still remains a common first step. Peer recovery is a service provided by the ED that combines interdisciplinary team members in developing a comprehensive care plan for patients suffering from substance abuse disorder. These staff members help patients navigate socioeconomic barriers, medical treatments, support services, housing, and more to make recovery as seamless as possible. The mission by Community Medical Center's Emergency Department is described as providing comprehensive, equitable access to healthcare for all members of the community. This motive is driven by the core values outlined in the hospital's mission statement, reflecting teamwork, compassion, accountability, empathy, curiosity, kindness, and respect. These values align especially well with treating vulnerable populations because healthcare staff are often the first people that encounter these populations and serve as the bridge to recovery. The nurse plays a vital role in advocating for these patients to ensure their care is holistic and continues after discharge. The population most vulnerable to substance abuse does not discriminate. Addiction can occur in any gender, race, age, socioeconomic class, geographic region, or sexual orientation. With that, it is crucial to present education about substance abuse prevention with everyone and provide resources for patients to seek help if they feel they need to. There are risk factors that place individuals at a heightened risk for substance abuse disorders, such as lower socioeconomic status, unstable housing, poor social support, low self-esteem, history of mental illness, and knowledge deficits. The statistics reveal that substance abuse is growing exponentially and that the ED is being exhausted of resources with the growing amount of cases that could be managed appropriately outpatient. Quote, the rate of ED visits with a primary diagnosis of a substance use disorder complaint among adults increased from 74.4 per 10,000 population during 2018 to 2019 to 103.8 per 10,000 during 2020-2021. Among adults aged 18 to 34 years, it increased 42%, and among those aged greater than 35 years, it increased 38% per the CDC. The data reveals a desperate need for intervention to support sustainable change. Utilizing the ED as a primary source for recovery is exhausting the ED's resources and is not proving to be beneficial for this population's health outcomes. The intervention I'm proposing is a discharge brochure helping patients navigate their resources to more appropriately seek treatment. This is based on a foundation of structured education. Community outreach will help teach patients about substance abuse prevention, outpatient resources, and naloxone preparedness. These core concepts will help patients delineate what information they need and ultimately find their answers within the brochure. A peer recovery specialist noted, quote, we are dealing with people at their worst when they are actively intoxicated or withdrawing. As much as we are there to help, they usually aren't in a state to receive our education or support, which leads to cyclical episodes of patients coming through the ED without getting the help they really need. Quote, Other modalities included in the brochure will be peer support lines, follow-up support managed by a social worker, referrals for inpatient and outpatient detox centers, and community socioeconomic resources. These targeted interventions aim to empower patients to seek help in a way that feels most aligned with their recovery journey. The education plan is based on the foundation of Knoll's adult learning theory. This theory is based on the principle that adults learn from three primary domains: cognitive, affective, and psychomotor. As it relates to substance abuse disorder, this would indicate that the patient recognizes a need for treatment, cognitive, feels a change in attitude towards wanting recovery, affective, and moves forward with an actionable step towards the goal, psychomotor. With these principles, the method of implementation is engineered to these needs. The nurse recognizes the need for an intervention for the growing rates of substance abuse cases and develops the goal to promote self-advocacy for recovery. The brochure, being tailored to the patient's multimodal needs, is the objective and is implemented by being provided to patients upon discharge from the ED, and the community agency helps circulate the brochure so it reaches patients before utilizing the emergency department. Finally, the evaluation method most appropriate for this plan is to assess what percentage of patients who receive the brochure follow up with any of the listed resources. The target is for greater than or equal to 60% of the patients to utilize the resources. An additional layer of evaluation would be to coordinate a social worker to call the patient within 72 hours of discharge to answer any follow-up questions. The purpose of the brochure is to empower patients suffering from substance abuse disorder to take recovery into their own hands. The journey to recovery is intimidating. This brochure helps them to see their options clearly and choose a path that best aligns with their needs. The versatility presented on the brochure helps patients recognize the various methods of recovery. The brochure also includes community resources, socioeconomic resources, housing options, recovery center information, support service lines, peer recovery contacts, and tailored education. In a non-judgmental way, the patient is provided an abundance of choices and provided the autonomy to discover their best path. The overall experience of observing how substance abuse has impacted patients, families, and the emergency staff has been humbling. The unfortunate truth I have learned is that the ED is used as a safe space for patients who feel they have nowhere else to turn. The goal of this brochure is to ensure that patients know they have plenty of flexibility and can feel safe to embrace other resources when they are in need of help rather than related to substance abuse. A successful trial of this brochure would be indicated with a general decline of substance abuse cases presenting to the emergency department and a generally higher rate of admission to outpatient or inpatient rehab or detox centers. This inverse relationship would signify that the brochure was well received by the intended population and that they are taking the advised actions that the brochure outlines. The goal is to see greater than or equal to 60% of patients utilize the resources provided by the brochure within 1 month of discharge from the emergency department. Another layer of help to implement this change would be to have social work consult with the patient 72 hours after discharge to answer any follow-up questions, help to arrange appointments, or connect the patient with necessary resources towards recovery. With these interventions in place, the goal is to build a healthier community and empower vulnerable populations to live fulfilling, addiction-free lives. To sustain change in this vulnerable population, my recommendation is to utilize the resources listed in the brochure. The resources available from the community are designed to help patients through recovery. Instead of turning to the ED, where beds may be scarce and resources are allocated towards the sickest patients, I would recommend patients seeking recovery to turn to the brochure. This packet outlines resources as well as phone numbers and locations to make getting help as seamless as possible.